today's seminar is how Korea turned the tide on COVID-19 using ICT. We had lots of requests on this issue, so we decided to organize this seminar today. My name is Ki-young Ko, Director of APC ICT, Asia Pacific Training Center for ICT for Development under ESCAP. Before we begin, I'd like to briefly introduce about our center and objectives of today's webinar and the program. Next slide, please. Okay, our center was established in 2006 in Republic of Korea, and we have been operational for 14 years now. And our mandate is to build ICT human and institutional capacity for ESCAP member states, 62 countries. And we have three major activities. Number one is capacity building for policymakers and civil servants. And second, we provide technical assistance, for example, policy and strategy frameworks. And also we provide a knowledge sharing platform, including e-learning. Next slide. For the capacity building program, we have three major target groups. First group is policymakers and the civil servants. And second group is women entrepreneurs and related stakeholders and the future leaders. So we have a specific program for each target group. For policymakers, we have a program called Academy in purple color. And for women entrepreneurs, we have a Women ICT Frontier Initiative program, Wi-Fi for short, and we call Primer for future leaders. And if you are interested, please visit our website as written here, and we'll be pleased to support you whenever you need. Okay, next slide. About objectives of today's seminar is to, number one, to share Korea's experience in responding to COVID-19 using ICT technology. And the second, to identify digital solutions that may be replicated by other countries in the Asia Pacific region. And third, to discuss challenges that other countries may face in deploying digital solutions to fight against COVID-19. Next slide. About today's program, opening remarks will be delivered by Deputy Executive Secretary of ESCAP, and then we'll invite the two prominent speakers from Korea talking about how Korea fought against COVID-19 using ICT technology. And then we will invite the three distinguished speakers from the Philippines, India, and Singapore to share their country perspective. And then we will invite ICT and Disaster Risk Division of ESCAP Director to share ESCAP's effort to alleviate the digital divide in the region. And we'll have a Q&A session. Next slide. For questions and inquiries, please use YouTube live chat, or if it doesn't work, please email us at this email address. Okay, great. And then I'd like to invite Mr. Kaveh Jahedi, Deputy Executive Secretary of ESCAP. Mr. Jahedi, the floor is yours.
Thank you so much, Ki-young, and good morning to everyone that is linking into this webinar. Most probably from your houses, where like me, you find yourselves in some form of social distancing. Allow me to start with the words of the UN Secretary General about this pandemic that we're all dealing with. He said that COVID-19 is an unprecedented and devastating crisis that is affecting everyone, everywhere. No region or country is spared. This is not only a health crisis, but a human crisis, a jobs crisis, a humanitarian crisis, and a development crisis. its unprecedented scale demands an unprecedented response. Those are in the words of our Secretary General. And this unprecedented response has taken different forms in different countries of Asia and the Pacific, and indeed around the world. We are, of course, at the very early stages of learning from our successes and from our failures. But what we do know is that the Republic of Korea has led a very successful campaign against the virus, and that in that campaign, information communication and technology, or ICT, has played an important role. So we're very, very grateful to our colleagues from the Republic of Korea, Mr. Choi Sung-jun from the Ministry of Science and ICT, and Mr. Nam Sang-yil from the Korean Information Society Development Institute, for their readiness to share some of these early lessons with countries and with experts that may still be grappling with their own responses to COVID-19. But what we hope to learn today will help us beyond the immediate response. We have seen that life may not go back to the way it was, at least not until a vaccine is found, and maybe not even then. Things like social distancing, contact tracing, and many other measures that have been facilitated by ICT look to be here to stay. So the lessons of the Republic of Korea can help countries not only with the immediate response phase, but also in the subsequent phase of learning to live with the virus. In many ways, COVID and its aftermath are yet another challenge to sustainable development in our region. And that really is where the Asian and Pacific Training Center for Information and Communication Technology for Development, or APC-ICT for short, comes into play. APC-ICT is really very well placed to facilitate the exchange of knowledge and lessons learned on using digital solutions to address the pandemic through webinars like this one. But the work of APC-ICT can help countries in many other ways. In response to the acceleration in the use of digital solutions, APC-ICT will also strengthen the digital delivery of its capacity development programs that Keong presented at the beginning, through, for example, its virtual academy. APC-ICT will also offer training programs on the use of ICT for disaster and emergency situations, including a new academy training module on ICT and disaster risk management, looking at prevention, looking at preparedness, looking at response and recovery from disasters, including slow onset ones, and of course, pandemics. APC-ICT will also help to support those most impacted economically, particularly women entrepreneurs who will need assistance on navigating the effects of COVID-19. Our capacity development program on ICT and women entrepreneurship will identify and share practical ICT solutions for women entrepreneurs to mitigate the impact of the pandemic in their businesses. So before I finish, again, on behalf of myself, on behalf of the UN Economic and Social Commission for Asia and the Pacific, allow me to thank our APC-ICT Director, Keong, and his team for organizing this webinar, and to thank all the distinguished speakers and our esteemed moderator for taking the time to join us today. And of course, to thank all of you that have joined virtually today to hear more about the Korean journey. We hope that the work of UN ESCAP, including our institutes like APC-ICT, can play a role in helping the region to deal with and to build back better from this pandemic. Thank you very much, and back to you, Keong.
Thank you, Mr. Johedi, for your excellent, nice opening remarks. And now I'd like to introduce to you today's moderator, Ms. Mangar, Anjur Mangar. She is Asia Regional Coordinator of the famous World Wide Web Foundation. And then before I hand over to you, I think we have about 200 plus participants as of now. It's increasing. And then I'd like to, the floor is yours, Mr. Mangar.
Thank you, Mr. Ko. Good morning and good afternoon to our wonderful audience tuning in from the Asia Pacific region and other parts of the world. And a warm welcome to our fellow speakers from Republic of Korea, India, Singapore, Thailand, and Philippines. My name is Anju Mangal, and I will be the moderator for this webinar. So before I start, I just want to convey my condolences to families, friends, and colleagues who are suffering as a result of the COVID-19 pandemic. And just a word of empathy, and as Mr. Zahidi said, we are in this together, so please stay healthy and continue to be kind to each other. Quick virtual housekeeping rules. Please send your questions to the host and keep it short and to the point, please. And to our speakers, please be mindful of the time. So just a bit of background about myself. I am the Asia Pacific Regional Coordinator for Alliance for Affordable Internet. It's a global coalition of the World Wide Web Foundation, and we work together to drive the cost of internet access in low and middle income countries through policy and regulatory reform. And we continue to recommend our governments, companies, and civil societies to take urgent actions to bring as many people online as possible during this global COVID-19 pandemic crisis. So today we have a total of 6 speakers. So sit back, relax, and enjoy your cup of tea or coffee and enjoy the wonderful conversation. So without any further ado, I would like to introduce our wonderful speakers. Mr. Choi Sang-jun, Director of Multilateral Cooperation Division of Ministry of Science and ICT in Korea, and Mr. Nam Sang-yeol, Head of Research Group on International Organizations and the Korean Information Society Development Institute. Our first speaker, Mr. Choi, will share his experience in responding to the COVID-19 pandemic using ICT. Handing over the virtual mic to you, Mr. Choi. Thank you.
Thank you, Ms. Mangal. Good afternoon and good morning, everyone. I'm Sung-jun Choi, the Director of Multilateral Cooperation Division in the Ministry of Science and ICT of Korea. First of all, I'd like to thank UN ESCAP and APC ICT to host this webinar and giving me a chance to share the way how Korea used ICT technologies to respond to COVID-19. The world is now facing an unprecedented novel coronavirus threat. Every country is putting all its resources and efforts into fighting against COVID-19. I hope the experience and knowledge of Korea shared today help every one of you better respond to the COVID-19. Next slide, please. Korea faced numerous threats and difficulties due to COVID-19 these past 3 months. Korea's COVID-19 cases per day reached a peak on February 29th. Thanks to the government's proactive and transparent measures, as well as citizens' voluntary participation, the number of new cases per day is now hovering around 10. Next, please. Korea has conducted COVID-19 diagnostic testing to a wide range of public within a short period of time since the early stages of the spread of the virus. The massive scale of diagnostic testing is essential to minimizing the damage from this highly contagious virus. With R&D support and emergency approval for medical devices, the government supported companies to rapidly develop testing kits and launch them in the market. As of now, 7 companies got emergency approval for COVID-19 testing kits. Some of these companies, like Seagen, used high-performance computing and AI algorithms to dramatically shorten developing time. Next slide. Korea's AI-based medical image analysis companies, including Vuno and Lunit, train their AI algorithms with large-scale chest X-ray photographic data to develop a small device that can detect abnormal lung conditions of COVID-19 patients in just a few seconds. Their devices can be attached and connected to portable X-ray equipment in COVID-19 screening centers or ambulances. Next slide. Korean government has developed the self-quarantine safety app to effectively support the monitoring of those under self-quarantine. Residents in Korea can voluntarily install this app. However, all the inbound travelers, including Koreans, are required to install it to enter Korea since April 1st. This app has three key functions. First one is a self-diagnosis for the users to conduct and submit the results with the assigned government officers. Second one is a GPS-based location tracking to prevent possible violation of self-quarantine orders. And third one is providing necessary information, including self-quarantine guidelines and contact information of the assigned government case officers. This app has been effective in monitoring those under self-quarantine and making sure that they stay in designated locations, while the information submitted to the officers by the app is not shared with others for the privacy protection. Next, please. Contact tracing is an important part of epidemiological investigation. With the spike in the number of confirmed cases in February, there was heavy workload for the epidemiological investigators. Korean government developed a computer-aided epidemiological investigation support system to quickly and accurately analyze the large amount of data. The KCDC, the Korea Centers for Disease Control and Prevention, operates the system in close coordination with the National Police Agency, telecommunication companies, and credit card companies. The system can quickly identify the transmission routes and places that the infected has visited by using real-time analysis of data, such as GPS and credit card transaction history. Because of the growing privacy concerns, the KCDC operates the system in a very strict manner to protect privacy. Access to the system is granted only to a few officials with different level of authority according to their duties. Abuse of personal information can be prevented as the activities of each user is under strict surveillance. All personal data stored in the system will be deleted after COVID-19 is over. Next, please. With a surge in demand for untech digital services like remote learning and working, Korean government inspected the emergency response system of broadcasting and telecommunications service providers. Major telecommunications service providers have ensured that the movement paths of key facility management staff do not overlap to prevent the mass quarantine of staff at the same workplace. And in case of building shutdown, network operations will be remotely carried out. Although Korea's network capacity is not experiencing a shortage as of now, the government has ordered network providers to increase in the number of lines in preparation for a sudden surge in traffic. Next, please. As schools have been shut down due to COVID-19, students and teachers are struggling with unprecedented online education. There are around 8.4 million students in Korea, including elementary, middle, high schools, and universities. To support online education, central and local government, telecom providers, and ICT companies are gathering efforts. In response to the shortage of smart tablets prepared by the government for children in low-income families, Samsung and LG Electronics donate 36,000 tablets. Telecom providers apply zero rating by exempting educational websites from data allowance. To support remote working, the Korean government opened a website to provide information about companies providing solutions for remote working and their products. Next slide. With people's growing concerns over face mask shortage, the Korean government allowed only public retail platforms, including pharmacies, post offices, to sell face masks. To reduce people's confusion and inconvenience while raising distribution efficiency, the government has provided real-time data of publicly distributed face masks to the public. With the public-private partnership approach, the government released the data on the face masks sold at public retailers. Cloud companies provide cloud and map resources, and the app developers use the data to develop and provide information services for the public. Citizens can use apps or visit websites to check face mask stocks at public retailers. Next, please. Korea is implementing measures to enhance response to scams, as phishing and smishing attacks are on the rise, preying on fears of COVID-19. Alert text messages are sent out on a regular basis to inform all citizens of cases of scams and coping methods. Upon the report of the scam cases, the number used for phishing will be immediately suspended. Next slide. COVID-19 is a big threat to all humanity. With the presentation of Korea's experience using ICT technologies to respond to COVID-19, ICT is an effective tool to fight against pandemic. With the full use of ICT technologies and proactive international collaboration, I hope we humans can overcome the pandemic shortly. For more information, you can visit the website given here. Thank you very much.
Great. Thank you, Mr. Cho. A really great presentation and well done to the Korean government for COVID-19 response. I would like to reiterate what he said. With ICT and international collaboration and partnership, we can all overcome the pandemic, particularly to support remote learning for low-income families. So again, it's all about working together. Sorry, Mr. Choi, can you mute? Sorry. Thank you. So before I introduce you to the next speaker, and just for everyone's information, we have a total of 250 tuning in today. So thank you so much. Our next speaker is Mr. Nam Sang-yeol, and he will be presenting on the pandemic response with ICT and artificial intelligence. Handing over the mic, virtual mic. Thank you.
Thank you, Ms. Mangba. Good morning, good afternoon, and probably good evening, wherever you are. My name is Nam Sang-yeol.
Sorry, my apologies. There is a bit of background noise. I'm not sure where it's coming from. Technical staff, please help.
RD, can you intervene and call him through his mobile phone?
Yes.
We have a backup line with Mr. Nam, so just wait a little bit and thank you.
In the meantime, I will continue, and I would just have a question for Mr. Choi. Mr. Choi, what were the conditions in Korea that facilitated the success of ICT in the process to contain COVID-19? Thank you.
Okay, thank you, Ms. Mangal. Korea's fixed broadband subscription rate is around 42%, and mobile broadband subscription is over 100%. Korea has highly advanced fixed and mobile broadband infrastructure. We also have many CCTV cameras around the country, and credit cards, including transit cards, are widely used by people. In Korea, digital technologies are deployed in everyday life. Such advanced use of communications infrastructure and emerging technologies helped Korea efficiently manage confirmed cases and carry out epidemiological investigations. Thank you.
Thank you so much for the quick response. Is Mr. Nam Sang-yeol ready?
Yes, Mr. Nam.
Perfect.
Yes.
Over to you, Mr. Nam. Yes, we can. Please go ahead. Thank you.
Okay. I continue. Thank you, Ms. Mangal. Good morning, good afternoon, and probably good evening, wherever you are. My name is Nam Sang-yeol. I am a senior research fellow at KIST, Korea Information Society Development Institute, and I am pleased to contribute to this APCIC webinar. Before I begin, I would like to ask your understanding that the following material was originally made by my colleague, Dr. Ko, for his presentation at the webinar between KIST and the World Bank early this morning. And I myself also made a presentation at the webinar organized by ICT-based, EWWG, and ESCAP 2 weeks ago with this update. Next slide, please. Sorry. Okay. I'll talk about Korea's responses to COVID-19 pandemic with ICT and AI technology, focusing on three things. First, preemptive tests of COVID-19. Second, social distancing and contact tracing. Third, public mask distribution and open data. Next, please. Let me start with how Korea flattened the curve of confirmed cases with preemptive tests. Next, please. The number of daily confirmed cases of COVID-19 in Korea increased exponentially in late February and peaked to 909 people on February 29, then decreased to around 100 in later half of March, around 50 in early April, around 25 on April 13, and 10 on April 26. We have 10,728 confirmed cases as of April 26. 81.3% of them released from quarantine, and 242 deceased due to COVID-19. Next, please. Korea aggressively tested for COVID-19. Only United States, Germany, Turkey, and Italy conducted more tests for COVID-19 than Korea so far. Next, please. In terms of the number of tests per 1,000 people, Korea stands out, especially in the early stage of outbreak. Next, please. Extensive testing was possible in Korea with early and sufficient supply of test kits produced by domestic companies. In fact, AI-based big data analysis system was utilized for the development of test kits. Government approved the test kits on the fast track. Next, please. With open and cumulative medical image data, a Korean company was able to diagnose COVID-19 and pneumonia in 1 minute with AI-based medical image analysis software. Next, please. Now, let's turn to social distancing and contact tracing. Next, please. Korea learned two important lessons after the MERS crisis in 2015. One is that we need a central control and commanding center. And the other is that keeping good public health is as much important as strictly protecting privacy. So the Korean government created the Emergency Operations Center under the KCDC in 2016 and amended the law to empower public health authorities to access relevant information in order to deal with public health crises. Next, please. Korea's privacy-related laws are quite strict, but there is somewhat flexibility for the purpose of public health, safety, and security. Next, please. With the amendment of the law after COVID-19 crisis, local governments were also empowered to have authority to request for location data of confirmed patients. Next, please. Korea completed a smart quarantine information system in 2017. The information about the inbound travelers has been collected by KCDC from various sources. Next slide, please. Korean government stepped up contact tracing by using the COVID-19 analysis support system, co-developed by Ministry of Science and ICT, the Ministry of Land, Infrastructure and Transport, and KCDC. The system allows various data, such as surveillance camera footage and credit card transactions of confirmed COVID-19 patients, to be immediately analyzed and provided to health investigators. The analysis ends within 10 minutes with this system. It is less intrusive to privacy since only authorized health investigators have a right to access to the system. In addition, it is operated only for the period of COVID-19 pandemic crisis, and all the data will be discarded after the crisis. Next, please. Inbound travelers who have direct contact with confirmed patients are required to self-quarantine for 2 weeks in Korea. Next, please. Those who are self-quarantined should install the self-diagnosis mobile application and proceed with daily self-health check. Next, please. And have a daily telephone call, probably with AI. Next, please. More traditional way of telecommunication, telephone calls, and text message are also a powerful tool for combating COVID-19. KCDC call center provide comprehensive information on COVID-19. Next, please. Central and local government in Korea send mobile text message of the infected person's travel details with anonymity by pushy system to all the people in the person's vicinity. Campaign on social distancing and COVID-19 prevention tips are constantly pushed in mobile text. Next, please. Lastly, I'd like to explain public mask distribution and open data in Korea. Next, please. Asian experience taught us the masks are the most powerful weapon for our war with COVID-19. Korea government made the distribution of masks public and became a sole wholesaler in the domestic market. Since supply is limited, each person can buy only 2 masks per week with their ID card at nearby pharmacies. To prevent repeated buying, existing drug utilization review system was used for public mask distribution. This system was originally designed for drug safety inspection by checking patients' medication history with the pharmacist network. Next, please. to ensure availability of the public mask for every citizen. Information on location of pharmacies with amount in stock is provided in mobile apps. The system was developed by utilizing open data collected by government affiliated agency, National Information Society Agency, NIA, and provided by cloud companies. Next slide, please. Korean government released various open data related to COVID-19 via data portal www.data.go.kr. Private sector developed many applications and web pages that provide user-friendly information on COVID-19, such as confirmed patient movement path, proximity to confirmed patient visited location, and so forth. Next, please. In terms of COVID-19 pandemic response and recovery, we cannot overemphasize the importance of digital infrastructure readiness and resilience. ICT and digital technology, especially AI, as well as information sharing and confidence building for public-private cooperation while responding to disinformation. Please refer to the following references for further information. Thank you very much for your interest. Thank you.
Thank you so much for your presentation, Mr. Nam Sang-yeol. I'm glad you were able to connect again. I just want to highlight what you said in regards to using smart city technology system and big data. Unfortunately, developing countries or countries with low income are still struggling to have such systems because we don't have policies or resources that support such systems in developing countries. So perhaps in the future, the Korean government can also work with us, the developing countries, to support such systems. So due to time constraints, we have to move on to other presentations. I apologize. We are now going to highlight country perspectives. So let me introduce you to the following speakers. Our first speaker is Mr. Emmanuel Lalana. Emmanuel Lalana is the Chief Executive of IDEACOP, a Philippine-based independent non-profit organization focused on digital development. Over to you, Mr. Emmanuel. Thank you.
Thank you, and welcome everybody to the seminar. South Korea's use of ICT in turning the tide on COVID-19 is exemplary. Next slide, please. The praise that it has been getting are indeed well-deserved. But I would add that South Korea is not an outlier in East Asia. China, Hong Kong, Chinese Taipei, and Singapore have all deployed digital technologies, particularly mobile apps, to contain the contagion. East Asia leads the way in using digital technology in combating COVID-19. Next slide. I also believe that developing countries will be hard-pressed to follow South Korea's best practices. This is largely due to significant differences in ICT infrastructure, digitalization of government, availability of accurate, up-to-date data in digital format, data privacy, and state capacity. Next, please. South Korea was able to extensively deploy ICT in the fight against COVID-19 because of its world-class ICT infrastructure. And this was already noted by our first speaker. If you compare South Korea, which ranked second for mobile internet speed and 18th for fixed broadband speed, the Philippines is way below, 116th and 104th respectively. Indonesia, not far behind the Philippines at 118 and 113. The second challenge that we face, next slide please, is the degree of digitalization of government. Again, in developing countries, many government processes are manual, and those processes that are using ICT, the use of ICT has not been maximized. Let me just point to contact tracing. I think everybody by now knows how important contact tracing is in fighting the disease. But for most countries, contact tracing is largely a manual affair, and it is a very time consuming one. Even in the United States, they estimate that they will need from anywhere 100,000 people to 300,000 contact tracers to combat COVID 19. Now, we've seen that Korea has used, with much success, digital contact tracing. But I'll come back to that issue later on. The other area where you see the difficulty because of the low level of digitalization is in disease reporting. Again, in some countries, disease reporting is still largely manual. Hospitals fill up a form, they email or they fax to the central office, and then the central office collects, right, and then re-enters the data, causing backlog and huge delays in terms of having up-to-date, accurate data. And that's my next point. Next slide, please. That in many parts of the world, data does not flow easily from hospitals into the public realm or across borders. Global data standards have yet to be developed, and this creates gaps in data sets and in delays in how data can be used. Again, as I pointed out earlier, the combination of both automated and manual disease reporting has caused delays and quite a bit of error in terms of accuracy in the data. Next slide, please. The other issue is data privacy. Korea has been criticized for a fairly intensive digital contact tracing. Under its Infectious Disease Control and Prevention Act, the South Korean government is required to publish information that includes infected people's travel routes, the public transportation they took, and the medical institutions that are treating them. Furthermore, local governments, as long as they do not reveal the identities of confirmed patients with infection, are free to decide levels of disclosure on their own. Some have included restaurants where infected person ate, and even if they have been to love hotels. Unfortunately, there have been instances, as has been reported, that officials release enough information to make people with COVID-19 infection publicly identifiable, leading to cases of doxing and online harassment. Some have noted that privacy has been sacrificed in the name of public health and transparency. In the Philippines, for instance, an invasive digital contact tracing cannot be deployed. Our Data Protection Act, as well as an issuance of the National Privacy Commission, mandate that digital tools and solutions used to combat COVID-19 should preserve and protect the data privacy rights of individuals. This means that for digital contact tracing, these apps must be privacy preserving. This is not a huge hurdle because Singapore has deployed its digital contact tracing app called Tracing Together, which shows that privacy and digital contact tracing can go hand in hand. My final point is the difference in state capacity. Next slide, please. State capacity is the ability to govern effectively. and it is measured in terms of the extractive capacity of the state, the steering capacity of the state, the legitimation capacity, and the coercive capacity. Next slide, please. Here, I think, lies Korea's strength. As has been noted by news article, South Korea received high marks on state capacity. The other country that has received high marks in terms of state capacity is Vietnam. I think this shows that even developing countries would have strong state capacity. Just to show you this more concretely, can I have the next slide, please? We can look at mass testing, right? And I think here for us, the relevant information is on the last column. This is not my own slide. I just copied this. So their priorities are quite different. But for us, I think now, what is important is to look at the last column, which is the number of citizens per million that has been tested for COVID-19. States that have been traditionally known as being strong, like Singapore, would have a very high, right, state number of citizens per million tested. Countries like the Philippines and Indonesia would be fairly low. And Vietnam, as you can see there, is very good, as is Thailand and Malaysia. So state capacities underline, I think, all of this. If you are able to mobilize resources, including financial resources, if you're able to mobilize your pharma industry, if you're able to mobilize your tech industry, then you have a good chance of success in terms of combating COVID-19. Finally, I hope that next slide, please. I hope that my remarks are not seen as belittling South Korea's use of ICT to contain the spread of COVID-19. I do believe that Korea's use of ICT against COVID-19 represents best practice. But best practices are, in essence, methods that have worked well in a specific context. Next slide, please. What I'm saying is, developing countries need to adapt best practices to our context before we adopt it in our context. Thank you very much.
Thank you, Mr. Emmanuel Lalana. Great presentation. I'll come back to you because we are running out of time. So our next speaker is Mr. Amit Prakash, Associate Professor and Project Coordinator at the International Institute of Information Technology, Bangalore, India. Virtual mic over to you. Thank you, Mr. Amit. Hello, is Mr. Amit there?
Oh, yes, yeah. Thank you, Ms. Mangal, and welcome to the webinar. Can I have the presentation up, please? Right, so I will talk about a few cases of ICT use. It's not as comprehensive as what my Korean colleagues have presented, but I'll take off from there and try to make a few points. Something to continue from what Dr. Lalana was saying. Can I have the next slide, please? So this is India in terms of, this is 2-day-old data. In terms of number of active cases, we are more than 20,000 now. And mortalities are around 800. The cured discharged cases are around 5,000 odd. And if you look at the graph on the left bottom corner, the red cases, the red one is the active cases, the green one are those who have been cured, and the blue is mortalities. And if you see, the graph is actually steadily increasing. It has been increasing over the last 10, 12 days. I'll look at three states, in fact, two states in India, two provinces in India, and how they have been going about in terms of some of the ICTs they have used till now. The next slide, please. So at a Government of India level, our Prime Minister has been repeatedly, and the Ministry of Health at the federal level, has been repeatedly advocating for using an app similar to what my Korean colleagues were talking about earlier, which is called Aryogya Setu. It's a smartphone-based app. It allows people to understand what, based on their symptoms, what their risk, what kind of risk do they have, allows them to self-quarantine better, allows contact tracing to a certain extent, allows people to understand if they are near another COVID-19 affected person or not. So this is a mobile phone based app. This has seen more than 50 million installs and more than 5 million. Yeah, it's seen a lot of installs, 50 million installs in the country since it was launched about 15 days back. So this is at the Government of India level in terms of allowing or in terms of releasing an app which can be used by citizens across the country to manage various aspects of quarantine, various aspects of their health, understanding whether they are under risk, and to trace and for contact tracing. The concern with an app like this in a context like India is the mobile phone ownership is not 100%. 2018-19 survey said only 60% of the Indians own mobile phones, and of the 60% who own mobile phones, only 30% have smartphones. So an app like this, in that sense, gets restricted because of the infrastructure and because of the context in which we are. If we move on to the next slide. Right, so we look at a state like Maharashtra. So this is one of the bigger provinces in the country. It's a population of 120 million. If you see the trajectory here is very similar to India. It is currently accounting for more than say 30% of the COVID-19 cases, and the graph here is very steep. But I'll not talk of this because this is very similar to what the overall India case is. I'll talk briefly about two other states, one where I am currently in Bangalore. So this is a state called Karnataka. The population is 66 million. And if you see the red line, it's not as stark as the Maharashtra or the India line. It's kind of stabilizing, it's tapering down. But you still see that the green line is below the red line. So the number of active cases is still lower than the number of cases which have been cured or discharged. And the third province that I look at is Kerala, which has a population of 35 million. If you see, we are in a stage where this is a slightly more comfortable situation. The green line is above the red line, so the number of active cases is declining. The number of cases discharged and cured, they are improving. So I'll just briefly talk about these two states and what they are doing in terms of their ICT response. The next slide, please.
Sorry to intervene, there's a bit of background noise.
Okay, yeah, sure. Yeah, just a moment. Yes, so this is a state called Karnataka, and Karnataka is where Bangalore is, one of the IT hotspots currently, not only in India, but maybe across the world. Karnataka has a digital war room, and it has a dashboard like the one that you see on your screen, which allows the the team, which is being led by the Chief Minister himself, to track the number of cases in hospital, the number of cases under home quarantine, the number of persons who have completed home quarantine, and this is done not only at the level of the entire province, but it is disaggregated into local level districts and wards. So if you go to the next slide, Karnataka has been able to use data that it gathers from the portals and from different departments, and has been able to create these kinds of containment zone maps. So every person infected with COVID is identified, traced, and a containment zone is created, and then the local level authorities are requested to ensure, and this includes the civic and municipal authorities, this includes the health authorities, as well as those who are in charge of providing essential services, to ensure that containment strategies and containment practices are properly followed in this region. We will go to the next slide, please. This is Kerala, and we'll try to see what is Kerala doing in terms of its ICT and COVID response. So if you look at Kerala, they may not have a very sophisticated ICT-enabled dashboard as Karnataka has, but what they have been able to do is they have been able to do their contact tracing very in a very detailed manner, and they've used simple tools, and they've not used sophisticated ICT tools. They've used simple tools like flowcharts, and they have identified every patient or every person infected by COVID and have been able to trace where these people went. And through that tracing, they have been able to activate their local level administration to ensure containment, to ensure quarantine, to ensure that the right kind of right kind of measures are taken not only by the individual and their families, but by the local level administration. If we go to the next slide, please. So what is coming out from our experience in this province called Kerala, which we now see as one of the better ways in which COVID-19 is being managed in the country. We are moving towards a stage of flattening the curve here, and it appears that its robust public health system, Kerala has been lauded for its public health system even in the past, and a culture of thriving grassroots democracy with power devolving effectively to the village councils. And this seems to have helped in community outreach, in rigorous contact tracing, and mass quarantine. And they have been able to use ICTs, not very sophisticated ICTs, but they've been able to use simple ICT tools, leveraging on their strengths, and they have been able to provide a sustainable, an effective response to the crisis that we are facing today. So if you can click once more here. Yes. So I'll just continue from where Dr. Lalyana left. What we are trying to highlight here is different countries and different regions have different capacities for ICT creation and absorption. What the case in India, through these 2 or 3 examples, further highlights is that ICT applications need to integrate well with existing contexts. Strengths to overcome the weaknesses, and we need to be cognitive of what the context throws up for us. What is there in the context which we can leverage effectively? An app-based solution in a country like India or in many other parts of the world where smartphone usage, where data connectivities are not all that great, may not be very effective at this stage. If we are able to leverage our existing strengths, like grassroots democracy, like a robust public health system, we'll be able to overcome this in a much better way. Thank you so much.
Thank you so much, Mr. Amit. If you could please mute you. Yeah, thank you. Thank you so much again. Being mindful of time, I just want to introduce you to our next speaker, Mr. Freddie Ten, the Director of On-Sign Information Security based in Singapore. Handing over the virtual mic to you. Thank you.
Thank you very much, Freddie from Singapore. Okay, I realized that only organizers and presenters can share their screen. So I'm not able to share my screen.
Sorry, Freddie, have you sent your presentation to the technical team?
I think someone has just made me a presenter. Okay. Okay. So are y'all able to see my screen?
Yes, please go ahead.
All right. I'm mindful that quite a number of you are actually joining through audio, and so what I've done is I made my slide very light. I prefer to elaborate more for the benefit of those who only have audio access. Now, Singapore's strategy in using ICT to combat against COVID-19, I think we have a couple of areas that we have focused on using ICT technology. I begin first by communications. So one of the challenges you always have is you will always have people who will spread rumors, spreading fear, and I think some of you would have heard about the panic buying. That's the challenge. When in a crisis, people have fear and they are easily influenced when there are rumors. So one of the things the Singapore government has done is to actually provide communication, timely communication to the citizens. However, I must highlight that in a very in an economy like Singapore, where we have a substantial number of elderly people, the elderly people, unfortunately, though they have smartphones, they are not very very comfortable using some of the social media apps. So you'll find that there is limitation in the use of ICT. I have to say that the use of ICT also brings about challenges, and I'll elaborate more of that later. We also use ICT for contact tracing, definitely. That's one of the things that ICT does very well. And so you find that, we have actually developed a mobile app around that. I'll talk more about that later. We also provide what we call services, all right, public services. Like, for example, when you are unwell, where do you go? So we have designated public clinics as well as private clinics that are equipped to handle pandemics. And we have also arranged transport services. I think it's very important that it's not just ICT, but the logistics behind it need to also be looked upon end to end. So when a patient, a potential patient is identified, we actually have worked with taxi services where taxi drivers are actually equipped with the right personal protection devices, all right, and they can bring these potential patients to the hospitals, and after that they are required to actually disinfect their entire taxi. All right, so this is to stop infection through use of public transport. We also have what we call publicly distributed face masks. So these are the ones where we have designated areas where the public can actually go to. Social distancing, I think, is very important. And so in a very crowded city like Singapore, we have used applications to help our citizens, all right, to know which supermarket is not crowded, all right. And so we have actually developed an app for that. Reporting of irresponsible behavior. This is something that we have also added into an application that we already have. In the past, citizens can actually report on failure of any public service, like, for example, a street lamp, or they see some garbage in a certain area, they could actually report it. And we have actually added that into the app. We have also introduced home-based learning for our students. All our students today are not required to go to school. And this is where I would like to highlight that when we first introduced home-based learning, they use a particular teleconference solution, which unfortunately the solution had vulnerabilities. And there were FIDO files that actually went online and caused a lot of embarrassment to the students. All right, so we have switched. All right, we have switched out from that particular solution, and today using a solution which is much more secure. All right, against unauthorized access by these FIDO files. The other one is, of course, work from home. Today, 85% of Singaporeans are required to work from home. Even for essential services, we limit the number of people that are allowed to go to office to work. And that is, again, an area where, unfortunately, a lot of companies, especially small, medium enterprises, they are not equipped with the right security solutions to protect, their employees when they are working from home. Something that, again, is required in Singapore is that employees are required to report to the employers their daily temperature. All right, so 2 times a day, every one of us, including myself, all right, I have to take my temperature and send it to my employer. And in the larger businesses, all right, they have actually web services whereby you can go online and you can report your temperature. So now I'll go into each one of them. For communications, what we have done is we have various social media means to reach out to the public. Telegram is one of them, Facebook, Twitter, Instagram, even YouTube. All right, but like I said, the challenge always is the elderly people. All right, we call that the digital divide. Unfortunately, the elderly people still prefer the traditional media, such as the TV and the newspaper. Right, so this is just a snapshot, all right, of how the government actually informs the public of the number of cases there are in Singapore, all right, and the number of people that are in hospital and so on. Next is contact tracing. Yes, thanks to Boeing, yes, we have actually come out with an app on mobile called Trace Together. All right, this is something that Singaporeans can actually download on their phone. And this is to actually help people, because people tend not to remember, like, for example, where were you the last 2 weeks? I don't think every one of us exactly know now every day the last 2 weeks where we were. So this actually helps the authorities to kind of look at, where you were. And the information is actually stored on the phone, not on the government data center. So when you actually become a victim of COVID-19, the government then would use the information from your phone, all right, to actually put it into our database. And that is where we use AI and machine learning to actually do the contact tracing, all right, to know who else potentially may have you have come across that may be potentially a victim. Next is the one that I was talking about, all right, like, for example, where do you go to the nearest, we call it PHPC, all right. PHPC is a public health preparedness clinics. So these are special clinics where the doctors and the medical staff are provided with the essential protective equipment, all right, to protect themselves against infection. All right, so you just have to key in your postal code and they will actually tell you where exactly is the nearest clinic that you can report to. All right, we have also distributed masks to our citizens, and that is where you key in your postal code and you know where you can go to collect your mask. All right, social distancing. So what we have done is, we are not allowed to go to office, but we still have to, go to the supermarket for our groceries. And so this is where the Singapore government has come out with an application for you to find out, all right, like, for example, my nearest supermarket is over at Vivo City, and I can find out, all right, the density of the shopping center. All right, is it very crowded or not? All right. So if it's very crowded, I may decide to then shop in another supermarket and skip that particular supermarket. All right. So that is something that we have developed. All right. It's available on the web. We have also done one for the parks. All right, because we have closed all the gyms in Singapore. All right, nobody can go to a gym, but people still need to exercise. All right, otherwise we all will grow fat and we have another problem after the COVID-19. So people still need to exercise and they are allowed to go to the parks. But again, we do not want crowds in the park. So what we've done is we also measure the density at the parks, and the public is kept informed of how dense the parks are. All right, and for my last slide, okay, reporting of irresponsible behavior. This is where you will see that we actually have this app. This is actually a municipal app that we have developed for people to report about nuisance, pests, dogs, and all these things, cleanliness. And what the government has done is they've added in safe distancing. So if you see someone breaching the rules, like for example, they visit their family, all right, in another housing estate. You can take a photograph of it and report to the police, and then the police will actually investigate into it. All right. Yeah. With that, thank you very much, and have a safe, keep safe, and we'll see this all through.
Okay. Thank you, Freddie. Keeping in mind that we have only 15 minutes left, or I think 16 minutes left, I would like to invite our next speaker. And let me just say the only female speaker on this panel, Ms. Tiziana Bonapesh, Director for ICT and Disaster Risk Reduction Division of ESCAP. Handing over the virtual mic to you, Ms. Tiziana. Thank you.
Thank you. Thank you very much, Anju, and a very warm hello, good morning and good afternoon to all our friends and colleagues on this webinar. I'd like to start off by complimenting the Republic of Korea on the COVID response. And I think it's really an example of how by combining digital connectivity, which brings openness and transparency, with science and with trust between government and society, something really significant can be done to turn the tide of COVID-19. I also recognize that other countries, and we heard very interesting and diverse experiences from across the region, have strides in containing the contagion, and each country within the national context has found ways of blending these various approaches. But trust between the government and societies, I think, is one of the important elements for success. And digital connectivity has certainly been at the center. And it's just last year that the 30-year anniversary celebration of the internet was held. And I think COVID has really brought to the fore what is the meaning of universal connectivity, and in addition, what does meaningful universal connectivity mean? Next slide. And so central, I think, to all the presentations we've heard up to now is that our digital lives, our movement from physical to digital has become the new normal, and digital has also served us well in terms of really being a weapon of combat against this COVID-19 war. And the underlying message is really the value of staying connected, the value of us as human beings in maintaining connectivity and connectedness. But let me also then remind everyone of the Secretary General, the UN Secretary General's quotation that our Deputy Executive Secretary Kaveh Zahedi mentioned at the beginning of our webinar, that we should not forget that this is a humanitarian, it's a human crisis. And most fundamentally, we need to focus on people and the most vulnerable. Next slide, please. And so the rest of my presentation is really going to look at some of the regional perspectives of the digital divide and what are some of the opportunities that COVID-19 may actually bring us. So I'd like to look at the digital divide in terms of three characteristics. One is access. And here you see access to fixed broadband connectivity. And you see it for the high income countries. The width of the bar shows the proportion of GNI per capita as compared to the other other groups of income countries, and here we see that the lower middle income countries, the blue bar, there has actually been a significant progress that has been made over the past 4 or 5 years in terms of bringing access to fixed broadband. But the key concern is really the low income countries where there has been very little progress for over the past decade or decade and a half. And why am I focusing on fixed broadband? As we know, the mobile broadband, there is more progress that has been made by the low income countries on bringing mobile broadband to greater segments of the population. But in times of crisis, in times when such as COVID-19, where there has been a tremendous surge in demand for bandwidth, the mobile networks can easily become overwhelmed. And in the worst case scenarios, the mobile networks just seize up and people cannot access the internet. It is those that have access to fixed broadband connectivity that have the best chance of getting or maintaining their connectivity to the internet. Next. So here, the access to broadband, fixed broadband connectivity, it's just shown by different sub-regions. And we see East and Northeast Asia having also made very significant progress in the past 5 or 6 years. But the Pacific island economies still being the most disconnected, together with South and Southwest Asia. Next. Now, the second aspect of the digital divide is affordability. And if we take the Broadband Commission's definition of affordability, that mobile broadband subscription packages should be less than 2% of GNI per capita, then we see that for the least developed countries, the landlocked developing countries, and then the small island developing countries, broadband is way above the 2% threshold. The worst case being the small island developing countries, notably those in the Pacific, where a monthly mobile broadband package on average amounts to 6% of per capita income. Next. And the third indicator is speed. And on speed, whether it's high income, middle income, low income, or very low income countries, in all cases, the speed for mobile broadband, which is the dark green and yellow bar. Those bars in all cases are always, the speeds are always lower than the fixed broadband. And then we see that in the very low income countries, the speeds of both mobile broadband and fixed line broadband are much lower than in all the other income groups. Next. And then finally, on the issue of latency, the internet delays. Once again, for the mobile connectivity, that is the red bar, the delays, the latency is always higher for mobile as compared to fixed line broadband. And then in low income countries, the latencies are much higher than in high income countries. Next. And so tackling this digital divide is really key to ensuring that when emergencies or crises like COVID-19 hit, they don't amplify the crisis, and they don't amplify inequalities, and they don't entrench people in poverty in a way that further exacerbates their vulnerability to the crisis. And so for a number of years, about 5 years now, ESCAP has been working on bringing seamless regional connectivity to Asia Pacific. And this is mainly by focusing on the infrastructure connectivity aspects, bringing cross-border broadband connectivity in a seamless way to all countries across the region. And so the COVID-19, if there is going to be any silver lining in this human crisis that has hit us in a relatively fast way, this might be an opportunity for a big push in investments in digital infrastructure. The need for such investments was clear even before COVID-19, because the emerging technologies, the frontier technologies, have really underlined the need for maintaining the momentum in continuous investments in digital infrastructure as demand for bandwidth increases exponentially over time with the widespread adoption of the frontier technologies. And COVID has just, I think, further underlined that investments in digital infrastructure have not been keeping up, even in some of the more advanced countries, but especially in those countries where the digital divide is at its widest. And so there is now a need to really look into this issue and make a big push to increase investments. And second is for meaningful universal access to affordable broadband. Perhaps there's a need to look at internet connectivity as a human right. And there are various organizations that have been working on this. And then, there is also quite an extensive document called the Principles for Broadband Connectivity and Development as a legal right, as a human right. And Finland actually became the first country in the world to enshrine in its constitution that access to the internet was a right of every citizen. And it was followed by Costa Rica as a small island developing state. So we do have some examples of that. And so perhaps the COVID-19 is also an opportunity to make a push for a greater recognition and a greater pact between governments and society in terms of ensuring that people can stay connected in the future through digital technologies. Thank you.
Thank you, Ms. Juliana. Thank you for the great presentation. So great news. We're extending this webinar for another 5 minutes because we now have 311 participants tuned in. No one dropped out, and this is a great success for our speakers. We have received a lot of questions from the audience, and it's directed to all our speakers, but given that we cannot answer all the questions now, we will email the questions to our speakers so that they can get in touch with you directly. So for now, let me summarize the key question, which is, I think, resonates with all of us and all the questions that are coming from the audience. We have heard some great case studies and good practices. We need to adapt good practices as presented by the government of Korea and other countries. So in respective to our developing Asian Pacific countries, how can ESCAP's ICT division and APC ICT pull together all these great initiatives and create new opportunities and possibilities for developing countries to tap on? Basically, how can we replicate these initiatives in developing countries? And may I ask Ms. Tijiana to respond? And also, if any of the speakers wish to speak or respond, please do so, but please keep it very short. Thank you.
Thank you very much, Anju, and thank you for that pertinent question. So I think actually Asia in itself is really emerging as a leader, a global leader in terms of how it has leveraged technology. And we also heard, very different cases and very different examples. And in some cases, it was more a blending of the technology with strong community spirit, strong community organization. And so it was technology and people working together. So I think the scaling up needs to be context specific, because what works in one country may not work exactly the same in another country. But I think that is really also the role of ESCAP. It's to ensure that through the cooperation, the multi-stakeholder cooperation, but also the intergovernmental cooperation, we can create the environment, the enabling policy environment that will ensure that these good practices can be adopted and adapted to the context of each country. But the essential condition for that to happen is that the infrastructure needs to be in place, because without the infrastructure in place, all the other parts of the internet ecosystem will not reach the people. Thank you.
Thank you, Ms. Tijiana. Is there any speaker that would like to respond as well? Yes, Mr. Nam Sang-yeol.
Okay.
I think you're having trouble with your phone connection.
I make my comment short.
Yes, please go ahead.
In terms of global cooperation, it is important to cooperate to establish resilient infrastructure to ensure inclusiveness in terms of accessibility and affordability and interoperability, and to address digital and smart divide. In addition, we need to facilitate information and best practice sharing while building confidence with enhanced privacy protection as well as against disinformation. And before I finish my comment, I would like to share my viewpoint that current global challenge of COVID-19 pandemic enabled us to better understand the vulnerable point of our economy and society, which could also be a momentum for our economy and society to facilitate innovation and digital transformation, as well as disaster preparedness, if current COVID-19 pandemic would address timely and appropriately. Thank you.
Thank you so much, sir. Is there anyone that would like to respond before I move on? Okay, so moving on. Thank you so much. So in summary, we will have to close the webinar now. So in summary, I would invite our governments, public-private partnerships, civil societies, and also our telecom mobile operators. Everyone should commit to providing all necessary support to keep citizens connected and also to provide good ICT infrastructure and enabling environment. And I would also like to suggest that our regional organizations should be doing this in partnership with the governments of the day. So without access to reliable connectivity and devices, billions of people are still being risked. So they cut off from the vital information such as health and safety, online learning, and the opportunity to voice their views. So on this note, a big virtual round of applause to all our speakers, and also, sorry, let me just turn on my video, and also to our brilliant ESCAP staff, resource technical team who made this webinar a great success. And now I'm handing over the virtual mic back to Mr. Kaur to say the final words. Thank you so much.
Thank you, Ms. Mangor, for your excellent moderation and time management as well. And I would like to thank all the participants out there, including participant Bhutan. Thank you. And for our future activities, we'll continue to facilitate the exchange of knowledge through this kind of webinars. And we'll produce some training materials on this ICT and crisis management. But before that, we will produce this case study on this one so that we can share our knowledge, including e-learning program. And for more updates, please visit our website as written here. I'd like to convey my special thanks to Korean speakers for sharing their experience. I think Korea is really put things all together well against the COVID-19 and well managed even privacy issues with the public and government mutual trust. I think that's very important. And the Korean experience reinforces why investment in ICT, as Tijana mentioned, is an essential investment that brings high dividends, including during this pandemic crisis. So thank you again, these Korean speakers, and I'd like to get more insights from you so that we can share your knowledge to the rest of the world. Okay, next page. Next slide. Those who participate through YouTube channel, under this description part, you can see this red box part, which is survey, a short survey. Please help us for us to improve better for the next time. So, and that's my final remark. Active participation. And thank you very much. And we expect we can provide more fruitful or useful seminar next time. So have a good rest of the day. And thank you so much for participating. Thank you and bye.
Thank you. Bye-bye.
Thank you. Thank you, Tijana.
Thank you. Bye-bye.
Thank you, everyone.
Thank you.
Bye.
Thank you.